The definition of pharmacy fraud is pretty broad. Pharmacy fraud can involve one of three what we call actors. So it can be the patient or the member, it can be the pharmacy, or it can be a physician, or it can be all three of those working together or as a pair. But specifically, pharmacy fraud is when someone steals or diverts some form of prescription drugs for financial gain. So it can be a member who finds a physician's pad and writes his own prescriptions and takes it to a pharmacy and commits fraud that way. Or it can be a pharmacy that submits a claim, what we call a phantom claim, which means they submit the prescription to the insurance company pays them for it, but that script doesn't actually exist. Well, pharmacy fraud is a serious problem. The FBI estimates that 10% of healthcare providers will commit a fraudulent act during their business career. 10% of claims is a lot of money. The National Healthcare Anti-Fraud Association estimates it at about 5%, and others have estimated it as low as 1%. But if you think about, even 1% of our healthcare bill, that's a lot of money. The National Healthcare Fraud estimates somewhere around $200 to $300 billion is committed in healthcare fraud every year. Funds really do need to take an active role in fraud prevention. Some of the more immediate things that funds can do that are kind of within their own control is to make sure that their carrier or their TPA or they themselves issue explanation of benefits to members so that members know that what claims are being processed on their own account and can say, hey, I never went to that doctor, or I never had that prescription drug dispensed. That's one way. But more importantly, funds should really talk to their pharmacy benefit managers. It's kind of an implied concession or implied thought that your pharmacy benefit manager is actually monitoring for pharmacy fraud, but in essence they really are not. And they don't have as good a thorough programs as they need to. So funds need to bring it up to their PBM, ask their PBM what's going on with pharmacy fraud, what kind of recoveries have they gained on their claims, and really have an understanding. Because again, 1% to 10% should be realized in savings for a fund, and if your PBM isn't reporting that they've recovered 1% to 10%, then fraud's going on and you don't know about it.